Hi, and welcome to Policy Unpacked, a podcast by the Global Policy Network. In this series, we dive into the policies shaping our world, from healthcare to sustainability to education, exploring how these critical areas intersect to drive meaningful change. So whether you're a policymaker, practitioner, or just policy curious, we're glad you're here. So let's unpack policy together. Hi listeners, I'm Stephen Riley, Deputy Regional Chief Pharmacist at NHS England North West and also an Associate at GPN. I'm delighted to host the Global Policy Network's new series, Unpacking the NHS 10-Year Plan. Today, I'm joined on the podcast by Shilpa Shah, the Chief Executive Officer of the North East London Local Pharmaceutical Committee. So thank you for joining us, Shilpa.
Thanks for having me on, Steve.
So I think for today, what we'd really like to focus on is some elements around community pharmacy and how it features in the NHS 10-year plan, and looking at the key shifts and how we can support that element through our community pharmacy sector and colleagues. So one key element really thinking about community pharmacy's role in prevention and access to care. Obviously, the 10-year plan emphasises prevention as an area of priority. So how has the role of community pharmacies in preventative care evolved in line with this vision?
Yeah, I think, to be honest, it's something we've kind of always done. We've not always measured it. We've not always had specific services in community pharmacy related to it. But I think about my career. I've been a community pharmacist now for 25 years. And I remember when I first qualified, our pharmacy used to deliver a smoking cessation campaign or service for local residents. And for me, it's services like this, substance misuse, all of this is around prevention. So for me, I think that it's something we've always done in community pharmacy. Before we had services in place, like for smoking cessation, people would come in and say, I want to stop smoking. How can you help me? What can we do? And then we'd kind of go through some processes with them, some behavioural coaching. We'd talk to them about what makes them smoke, how they can stop the habit part of that. So we did it anyway. And then it turned itself into an actual commission service. And it's the same with health checks as well. People used to sometimes come in and say, like, I don't feel very well. Can you check my blood pressure? And we used to just check their blood pressure and then we'd advise them what to do accordingly. Now, obviously, it's a national service. So I definitely think we do a lot more than we ever used to. But I do think it's something that community pharmacies are best placed because we are the healthcare profession, I guess, that you can walk into at any time. You don't need an appointment. We're open weekends, we're open late nights, etc. So I think we are so well placed in local communities and neighbourhoods that I think that we're the best people to be able to offer prevention in a really good way.
That's really good to hear. I think you really touched on some great points there, particularly around that our unique selling point as a community pharmacy sector is the ability for people to walk in, get care, get support without need for an appointment, and see a highly trained health professional in the pharmacist and also our pharmacy technician colleagues. So you also touched on some really good examples there of some of the public health support services that pharmacists and community pharmacy have done just as part of the day-to-day for years now, been morphed into actual commission services. So what public health services do you think currently delivered by pharmacies most directly support the prevention and early intervention goals of the 10-year plan?
I think the most popular one, alongside, I did talk about smoking cessation. I think that's been ongoing for very many years now. And it's something that, as I said, most community pharmacies deliver that service. And that obviously helps the campaign of Britain becoming smoke-free by 2030 for new people that, may consider smoking, but also helps those people that are currently smoking. But I think the other biggest one is after clean water, vaccinations have been the biggest thing that have saved many lives across the world, not just England. And that's a big part of one of the services community pharmacy offers. So obviously we've got the flu vaccination service, which has been going on for many years now. And this is for those people that don't necessarily go to their GP for anything. They don't need to see their GP, but they also don't want to get the flu, so then they can just walk into a pharmacy, have it in their lunch break, or just after work, etc., or at the weekend. And then following on from that, I guess that's what led us to sort of the COVID vaccination campaign. We vaccinated so many people in community pharmacy again because we set up. We have got 10,000 pharmacies in England, so that's 10,000 neighborhood hubs, as we keep, as you know, we're going to be talking about neighborhoods. We have 10,000 hubs that people can walk into, and they can be vaccinated. They can get help to stop smoking. So they're probably two of the key areas I'd be looking at. And I suppose the final one, the third one, would be around the cardiovascular service that we run at the moment with the hypertension case finding, and that's evolving in certain areas. My area, for example, has now started doing point of care cholesterol testing added on to the hypertension case finding. So it's how do we keep adding on? HB1AC would be the one that we'd want to do next going forward.
I think it's a really important point there. I think, as you say, I think particularly around the hypertension case finding as well, that they're massive national priorities, and a great role there for community pharmacy to work and to be that support amongst other healthcare providers and really take the place of the key healthcare provider. I mean, you've mentioned access as well through community pharmacies being a key selling point and a key position and perspective where pharmacy bases health hubs in their communities. So a key ambition of the plan is improving access to care. So how do you think community pharmacies are reducing barriers for patients, particularly thinking about either underserved or rural communities?
There's two ways of the way that we do this. So one of the ways is obviously by our opening hours, the fact that we are open late nights, we're open weekends, and we generally don't have an appointment-based system. You can walk in at any time. So I think that really helps patients come in. I think by us not being as formal as other healthcare settings, it gives people the freedom to maybe talk to us about things that they may not talk to other healthcare professionals about. So I think that's really important. And also now I think you do see a lot more pharmacies going out to do outreach in places where communities actually are or they gather. So, places of faith, community centres, libraries, etc. We're seeing a lot more pharmacies go out and do some outreach, hypertension work in those sort of places. And again, what that does is it allows us to be part of the community and go into the community for those people that may not necessarily visit a pharmacy. And I think, when we look at sort of where I'm based in North East London, we have some of the most deprived boroughs in the country, but we actually have enough community pharmacies to help serve the people of for those boroughs. And what we tend to have is the people that work in those pharmacies are normally from the community around them. So they speak the language, they understand the culture. And I think that's so important because it just gives people that kind of reassurance that it's slightly informal, I suppose, but also just really inviting and comforting to know that somebody who gets them is going to be the person looking after them.
I think that's such an important point that you make, and I think it's that real value of being based in the community, part of the community, and particularly with such a variety and diversity of different cultural mixes, ethnicities, and people's beliefs and how they want to access healthcare and what their values are. It's really helpful to have people from that community delivering the healthcare services, and part of that and sharing those messages is really crucial. I think it's a really important point, and again, another key element of how pharmacy is really well positioned to support our communities in those respects. I think some of the things you mentioned are really positive as well, being community outreach and really integrating into the communities. I just think on the lines of strengthening integration, obviously we're fully aware there's significant funding pressures across the whole of the NHS through healthcare, social care. We're going through a significant NHS restructure at the moment and making changes, trying to reduce inefficiencies. There's impacts on NHS England, on ICBs, obviously impacts on community pharmacies providers and other primary care healthcare providers and wider NHS providers. So thinking of the funding pressures being highlighted to us as a barrier to implementation and service delivery, how do you think the financial constraints are impacting the ability of community pharmacies to deliver on the 10-year plan preventative care objectives and ambitions?
Yeah, I think, as I said, community pharmacy is best placed to offer many preventative services to the public, but we do need remuneration for this. It's not something that we can be expected to do with no payment towards it, because we know at the moment pharmacy is really struggling. We're moving from a dispensing model to a service-led model. But the problem is the dispensing isn't going away. People are still needing their prescriptions, they're still needing their medication. So we still have to deliver that part of the business as such. And we know that it's really difficult at the moment with the cost of drugs and the fact that many pharmacies are now having to pay more for the drugs than what they're reimbursed by the NHS. And obviously this all adds up. So I think for me, it's around we can do so much more, but what we do need is our core funding to be at a level that allows us to be able to invest into automation, invest into a decent workforce so that we can deliver more and more services that will help with the public health agenda and the 10-year plan.
I think that's such a crucial thing you're making, particularly though the need for investments and support for businesses, how we can then develop those additional wider things and key elements of that nature. Another key element as well, thinking about restricted funding and things, what we have is a consideration around how we can do more with the resource we have available. So how do you think community pharmacy can work to be better integrated GP practice services or the primary care services and neighbourhood health models and things like that? How we think they could be better integrated to support those and be more included?
Yeah, I think our doors are always open. I think from a local pharmaceutical committee point of view, we're always reaching out to our counterparts in primary care, GPs in particular. We've also looked at various work streams with opticians and dentists as well, and we work quite closely with our secondary care trusts in the area too. So I think our doors are always open. I think that perhaps maybe at a higher level, maybe the BMA, etc., need to understand a bit more around what community pharmacy can do to support GPs in particular, because I think that's the two areas in primary care that are really sort of struggling maybe with people, with funding, etc., so workforce and funding. And from a secondary care point of view, yeah, absolutely, maybe again a bit more at a national level, what can be released out into the community that would really help. But I think it's about everybody, isn't it? A whole system approach to these things. And I think the whole system approach needs to be a bit more than just the whole system getting together and talking about what they'd like to do, and more about the whole system getting together and doing what they'd like to do.
Yeah, it's so right. I think it's so an important perspective to it's how the system can work collectively. It's a systems approach, not for individual providers or commissioning needs. And I think the key thing as well, which a lot of people lose sight of along the way, is the patient-centered elements, it's patient-centered outcomes, and how we deliver and commission design services around patient need, as opposed to benefit for other people. We need to put the patient at the heart of this. So thinking around some of the key things you've outlined there, so what do you think are the key policy or commissioning changes would most effectively enable community pharmacies to meet that prevention and accessibility plans outlined in the 10-year plan?
So I think the biggest thing would be changes around commissioning in that allow us to be commissioned for services that are often given to our GP counterparts. So either we can both deliver them so that the patient has a really good varied choice of where to go, or we consider, does community pharmacy deliver this particular service so that GPs can do a different service or a bit more advanced onto what we're doing. In terms of policy, I think there needs to be some big policy changes around workforce in community pharmacy. So when we look at things like Rs funding, and I know this is a really tricky one, and I'm not talking about taking any funding away from GPs for Rs funding, but is there something similar we could do in community pharmacy where we maybe fund a pharmacy technician for a few hours a week in every pharmacy to deliver some of these services that need to be delivered to patients? Not quite sure what we'd call it. But, there's similar ethos to the Rs funding. And I think also the other thing that we really need to change is, more and more pharmacists are going to be qualified as independent prescribers. But even before we get to that stage where we have enough independent prescribers to deliver what needs delivering, what about just basic things like if a prescription item is out of stock, could we prescribe an alternative within our kind of scope of, it's something we do every day. We know what we're doing. It's what we probably used to do before. And if there is a cream that's out of stock, but there's an ointment available, we actually have to get a new prescription for that. And to me, that just seems like, I don't understand why we'd be putting pressure on everyone in the system. We should have policy changes that allow us to make those easy, quick changes, because ultimately it's the patient that's, left without if we need to go around the houses to get that sorted.
I think you're so right. I think it's those key things really to make most use of our abilities, our skill sets. As you said, we've got a whole new cohort of pharmacists who will qualify over the next year and register who have the ability to prescribe, and we need to have things for them to be able to do, services they can provide. And there's some key things you've outlined there. There's basic things of medicines management and support for patient care, making those basic changes through to more complex service needs and delivery. I think just for our listeners as well, so the R's roles, it's the additional roles reimbursement scheme, which was brought in to support additional roles within GP practice initially. So things of initially how pharmacists started having really got a foothold working as clinicians in GP practice includes pharmacy technicians, social prescribers, paramedics, physiotherapists. There's quite a variety of different roles available. And as you've outlined there, I think it's how can we maybe look to develop that policy to make it more applicable to wider primary care and help fund additional roles through community pharmacy would be a really good way of bringing and building that neighbourhood team. I think there's good opportunities there as well. I think one key thing to be asked about as well, be thinking about impact and enabling innovation. Have you got any examples in where community pharmacy-led initiatives have directly contributed to measurable improvements either in population health and in line again with the plan's ambitions and goals?
Yeah, I mean, one example we've got in North East London, Tower Hamlets is a borough that was 20% behind the national average for COVID vaccinations. So we worked together with the public health team on community pharmacies, having a conversation with people around why they felt that the vaccine wasn't something that was right for them. And it was often just about dispelling myths. So they thought, oh, it may cause infertility, or it's got animal extracts in it, etc. So we were able to give them the right information, and it wasn't necessarily about, right, you now have to have the vaccination, but at least the decision they made was based on an informed decision. And we saw 3,000 patients, and 48% of them went on to have a vaccination, a COVID vaccination. So we know that we protected, just under 1,500 people from COVID that particular time. So for me, I think that was really good because we actually measured how many people we saw and how many went on to have a vaccination. So we could see a real clear difference that community pharmacist individual made to those patients that they spoke to. And it was a number of pharmacies across Tower Hamlets that took part in this initiative.
And that's a really fantastic example because again, you build in, brings in the point you made before about the community pharmacies, key selling point, the parts of communities, the people from those communities understand it. So having pharmacy colleagues and pharmacists as a trusted voice, a trusted healthcare voice within those communities, but to give the right information. It's not about forcing people into healthcare decisions, but helping them make an informed choice with the right safe information, which ultimately is going to lead to saving lives, which is really a really key thing of what we're here to do as professionals. I think with the 10-year plan as well, it also highlights the importance of digital transformation. How is technology enabling community pharmacies to deliver and monitor preventative services more effectively?
Yeah, so there's a few different things. So I guess, by having automation in pharmacies, so some pharmacies have got robots to help with the dispensing. What that does is it frees up workforce capacity so that they can then go on to deliver services for patients. We've got some pharmacies that use IT systems as their PMR systems that again really help free up capacity, but also allow them to do really good searches. So if you're searching for a certain age group of people who are not diabetic and you want to do a HB1AC with them, you can use your IT systems to identify those patients and obviously then send them an email, a text, or phone them and ask them to come in. And then obviously you've got tools as well. So, things have advanced since, you don't have to do phlebotomy and take a blood test for every single test that you need to do. There is now point of care testing for HB1AC, which is a really quick and easy test to do in a pharmacy. Now, of course, it would need to be followed up to be checked, etc., if that person came back as showing a high number. But at least it gives you a really good indication, and the same with cholesterol checks as well. So again, technology is evolving all the time and allows us to do these quick tests. And there's some companies out there that do tests that patients can do themselves at home. So, like a blood pressure monitor, you don't have to always do them in a pharmacy. There are some people that can do them at home. We do know that by having them done in a pharmacy, it's more likely to be more accurate because obviously we will do them under the right conditions, and also having that conversation with a healthcare professional, because you may get a bit panicked if the result isn't where it needs to be, or it could be that you've been running like to catch the bus, get your blood pressure checked done and it's quite high. In a community pharmacy, obviously we would just say to you, why don't you sit down and just relax for a couple of minutes and we'll do it again. But if you were to do that at home yourself, you might get a bit panicked that it was so high. So, there is lots of options out there for people. which is great because that's what we want. We want diversity in places that people can go to have preventative services done.
I think that's really some really great key examples. I think you say it's really interesting for is how technology, it's a fantastic enabler, particularly around the speed of test, ability people to do their own in-house testing of things. But it just shows you the importance of being having that trusted voice where you can have that conversation with a healthcare professional, help you understand the results, what it means, get their onward treatment and support. I think it's also interesting as well how technology, whilst can be very much an enabler, it can also be often gives a barrier, and not having interoperability with systems and things, which we're working on through NHS England and other key areas. But it's just that it can be both sides of the coin for people, which is quite an interesting perspective. Just thinking about preparing for the future, it's linking back on something you mentioned earlier about how important workforce was through the community pharmacy and the wider pharmacy sector. So obviously expanding roles will require the right skill set and right skills. You mentioned about independent prescribing coming on board more and being more prevalent. But what workforce development and training are needed for community pharmacy teams to fully contribute to the plan's prevention and public health goals?
Yeah, I think that there is a lot of good training already out there that community pharmacists, pharmacy technicians, and their teams all undertake. I think that's what's actually missing is community pharmacy having protected learning time, because everyone in the pharmacy can go off and do their own training for hypertension case finding, but there's nothing like doing a bit of group training, working together, having an expert coming in and talking to you all at the same time in one place. And obviously everyone learns differently, so that might not work for some people. But I think that's what's often missing, is that we don't have the variety of training available, be it because we don't have the setup that we've got protected learning time, or because it's just easier to do everything online. And that's what we often aim for, because releasing people to go out to a training day somewhere is often quite tricky and difficult. So I think that that's something that needs to change. And that, unfortunately, is going to cost money. It's going to come down to actually we need that funded. We need that funded by the by NHS England, I guess, to a certain extent, and the government, because we are providing the service to help patients to prevent them becoming more ill. So although it might cost money to do a little bit of training now, to do the test that's required or offer the service that's required, ultimately it's going to save thousands in the long run if we can prevent that person from having having to go into hospital or even into GP world, because that we know that costs more. So that's one thing that's needed. And I think the other thing is around everybody in community pharmacy, ensuring that everybody in their pharmacy is working to the top of their license. So if you are a pharmacy technician, how are we making sure that all our pharmacy contractors out there are supporting their pharmacy technicians in delivering all the services that they're able to deliver? How are we ensuring that as pharmacists we're not sort of doing the admin side of the business, but we're actually really focusing on delivering those services and doing only the things that we can do. And by having everyone work to the top of their license, not only will it give them ownership and get them motivated and excited to do their job, but it will also allow us to deliver more than what we currently may be.
That's very so true. I think there's some fantastic opportunities being brought through with the enabling pharmacy technicians to deliver services to PGDs and operate to a PGD, which is very new, something they've never been able to do before as part of their professional license. But I think, as you say, it's really important on those pharmacy contractor colleagues and us as pharmacist colleagues as well to really support our pharmacy technicians to make sure they're able to fully do this in a confident and competent way, so they can provide them services and then really work to the top of their license, and the whole pharmacy team's delivering the best of their ability. And it's such an important thing. I think looking ahead as well, what do you think the biggest opportunities and challenges are for community pharmacies to help the NHS achieve the long-term vision for a healthier population?
I think there's so many opportunities out there. We've currently got pharmacies delivering pharmacy first, which is amazing. But what we need to do is ensure that we open that up to many more conditions. We've got hypertension case finding, again, a great service that's helping us identify people that may have high blood pressure. But that needs to be opened up to also, do cholesterol checks on people and HB1AC. for me, we've got obviously the oral contraception service, which is a game changer for women that can just walk into pharmacy and get oral contraception, and that's being opened up soon to allow every pharmacy that signs up to be able to supply emergency contraception. So there are lots of opportunities to add on more services. So with that service, for example, could we add on a menopause clinic? Could we add on a pain clinic associated with menstruation, etc. So there's so many different add-ons that we could do. So I think opportunities are endless. I could talk about them for hours. I think the two biggest challenges we have are workforce in terms of actual numbers of people, and the training and development of our workforce. And the other challenge we have, which we've talked about already, is financial viability of community pharmacies. If we can get those two bits right, then yeah, we could do anything.
It's so right. I think there's some key policy elements there, but we get those right, in fact, the sky's the limit in terms of what could be delivered. I know, gathered from obviously where you've outlined there's some fantastic examples. I was going to ask you, do you feel positive about the future of community pharmacy in relation to the 10-year plan? But I get the impression that you've got a reasonably positive, optimistic outlook. Should we say so?
I have. I've always felt really positive about community pharmacy because I've seen it change over the last 25 years. And I've seen us do more than we've ever done before. When I first qualified, you literally used to check prescriptions. That was it. And then obviously we had MURs, flu vaccinations, etc. And since then it's just grown and grown. So I do feel positive. I still, would celebrate the fact that I work in the community pharmacy sector, and it's the one I've chosen to work in. And I love that we are helping our local communities. I think that's the biggest thing that that probably nobody can ever take away from us. So yeah, I feel positive. I feel that the current government that we have as well is really recognising the role of community pharmacy within the primary care sector. So I think that's a really positive stance as well. And my MP is actually Wes Streeting, so I get to meet with him quite regularly, and he's always really positive about what community pharmacy can offer. So that always makes me feel quite confident that we're heading in the right direction.
That's really important, especially when the key political leads have got pharmacy in their sight and they're interested. I think there's good scope there. I think that's always a really positive step as well. I mean, you've touched on workforce and funding as potential challenges. So what do you think community pharmacy really needs then to be able to deliver on the expectations of the 10-year plan? What's your top key enablers?
I think for me, it is about workforce. It's what can we do to change the way our workforce is working. I've already spoken about protected learning time. I've talked about sort of developing people and having them work at the top of their license. But I think the other thing is if we're really going to ensure that we are preventing, then not only do we need to be doing the different point of care testing, but we may also need to prescribe. And to do that, we're going to need a lot more independent prescribers. We can't keep waiting every year for a new cohort to come out. We've got to support the current pharmacists that are out there already working to become independent prescribers. And the one thing we need there is support, again, from the whole system, because we need DPPs for them. We really do need to be able to support them. WTE, NHS England are great at offering all these free places at university. So that's like, you've ticked off one box, but the second box we need is helping our pharmacists get DPPs.
I think you're so right. It's that the infrastructure piece. I think for me, it's how we invest and support that element. So to get the designated prescribing practitioner support to give that oversight and help people qualify as prescribers, the infrastructure and enabling pharmacies to deliver services is so crucial in terms of what we need to deliver this 10-year plan. So I think that's such a really important point you make. So we've now come on to the part of the podcast where, as with being a series, we ask guests for questions for following guests on the series. So one of the questions that we've been asked from last week from Yousaf, he's asked us to ask you, so within the future landscape of the NHS and the 10-year plan agenda, where do you see community pharmacy playing a role with the preventative agenda, alongside any thoughts you may have on how they can utilise their presence within communities when tackling key population health needs?
Yeah. I think, we are best placed. We are already in that community. We're already within that neighbourhood. I think maybe the next step, what we need to look at, and this is where we'll need support from our public health teams, and there's various tools out there as well that you can use for population health. what is it that is most needed in our local population? And that's going to be different. I've got 7 boroughs in North East London. The needs of people living in Havering is very different to the needs of people living in, say, Tower Hamlets. So how do we, depending on where our pharmacy is positioned and based, have a look at what the needs of the local population is and tailor our services to be able to, really look after those patients? And if we know, for example, like I said, Tower Hamlets, we know that the likelihood of diabetes is going to be higher than in other areas across North East London. So how are we, working with the public health team to come up with a HB1AC service? And, but even before that, how are we talking to people about eating healthy and maintaining a healthy lifestyle so that they don't even get to the point where they need the HB1AC testing to start with? So for me, I think it's around really thinking, almost going back to your pharmacy and spending a bit of time reflecting and thinking about your local community and what the needs of that local community is. And are you meeting those needs, or is there something you need to do differently to be able to meet those needs?
I agree. I think it's so important. I think it's that opportunity as well for pharmacy colleagues as providers and contractors to actually look at that and then even take those needs into discussions with their local neighbourhood teams or even with their integrated care boards and say, actually, we've got a need here, this is how we can help support it, and then open those doors and then wider discussion. I think it's so important. So Shilpa, it's now your turn now to think of a question for somebody else. So next week we're talking to Yousaf Ahmad, or hospital pharmacy colleagues. So is there any particular question that you'd like to ask them?
Yeah, I suppose we know that the part of the 10-year plan, the ambition is to move care from hospital into community. And from what I've seen, hospital is a very complex beast. I admire anybody that is a chief pharmacist in a hospital because there is so much going on that you have to spin lots of plates at once. And I guess it would be great to hear from Uzo how they feel that is going to work. What do they see that, if we was to say, what does that look like to you? So, what is the vision? What does that look like to Uzo?
That's a really good question. We'll make sure we ask Uzo that next week. So, unfortunately, everyone, that's all we have time for today. So I'd really like to thank you, Shilpa, for your time and fantastic insights that you've given to us in this discussion today. Before we do finish, though, is there anything you'd like to add or any final thoughts you can give the audience?
No, I think for me, it's just, it's really important. We've got a new government. We've got a new 10-year plan. And I know we've had a few plans before, but I think it's best to just really try and keep an open mind. And, if you always try and do the best for your patient, let's always just keep the patient at the heart of what we do, because if we all do that, then together, we'll become a thriving, healthy, our population will be, very healthy going forward.
That's really fantastic. I really appreciate it. Thank you again for joining us, Shilpa. It's been really great to talk to you today. So everyone, if you've enjoyed this episode, please do join us again next time on an episode of Policy Unpacked. Remember to follow GPN on social media, keep a lookout for new episodes available each week, and I hope you can join us next week. So see you then, and thank you very much for joining us. Goodbye.